Non-surgery options for thin, crepey lower eyelids. I am a Caucasian, 37-year-old female with bad under eye area, saggy with abnormally thin skin. I've consulted a surgeon who advised me against fillers due to my thin skin. It could lead to visible lumps, as well as surgery because there are no wrinkles when I'm at rest. I trust his suggestion. However, I was wondering if there is any other option for me, such as laser or peeling, so as to achieve a moderate improvement. I don't want to look like I was 20. Thanks a lot for your help.
Thank you for your question. You're 37 years old, you submitted 2 photos, and you describe your under eyelid skin as being thin and crepey. And you had seen a doctor who had advised against doing any type of significant intervention. So you're looking for an option for treating your crepey skin. Well, I can certainly help you with this. I'm a board-certified cosmetic surgeon. I'm a specialist trained, fellowship trained, I should say, oculoplastic or oculofacial plastic surgeon practicing in Manhattan, Long Island for over 20 years. And skin texture and quality of the eyes has been one of the great challenges that for which we've had many good options and solutions. And the key today is to really customize what's right for the individual patient. So thinking more holistically, just looking at your skin, it triggers questions in my mind about what has caused the skin to be this crepey. 37 is still very young, and when someone comes in with that quality of skin, we always look to the history. Is this mostly a genetic factor, which is more of a hereditary skin quality? People who have very light skin, light eyes, light hair tend to have thinner quality skin compared to people with darker skin. Then there's also other factors, factors that include sun exposure, smoking, physical stress, medical stress, environmental exposures. So we try to think holistically and try to intervene as best as we can through advice and guidance as to what you can do. Cut down if you're using tanning beds. Don't do that. If you're spending a lot of time in the sun, work on reducing that and wear protection. But with all that being said, what we've discovered and developed and in our practice is the use of something in addition to lasers. Lasers, I think, would have a potential role in your treatment, but I would caution you that with the proliferation of a lot of lasers and even non-laser devices such as radiofrequency devices, we're seeing more and more patients who've actually damaged their skin long term from very aggressive use of lasers or thermal energy devices. So it's important to master how much is the right amount for the skin. I always think of it comparable to like exercising in the gym. There's training and then there's overtraining. So when it comes to skin, what we've done is we've actually moved a little bit towards more of a regenerative methodology. And what we do is we use something called platelet-rich plasma. Now this is derived from your own blood, and it's a concentration of the healing and growth factors that we inject under the skin. There's a distinct advantage over lasers and thermal energy in that this procedure actually doesn't, quote, damage the skin in order to get a certain collagen response. Now, we do combine this with lasers and radiofrequency, but we tend to be more conservative with the lasers and radiofrequency, and we can be much more liberal with the use of platelet-rich plasma. Essentially, what we're doing is we're stimulating collagen and blood supply to the skin the way it would if the skin were injured. But in distinction is that with thermal energy can actually break down the skin. It can overheat the skin, and we're seeing that more and more. So I would say that with lifestyle changes and exploring the option of PRP or platelet-rich plasma as well as lasers, I think the right combination can help you in the long term. Platelet-rich plasma doesn't always work with just one treatment. We routinely do this more than once over the course of a year, so maybe twice a year, or up to as frequently as 4 times a year. But a lot depends on the patient's response. It's something about cosmetic skin enhancement that often requires observation before doing the next step. So I would recommend you explore this information, learn more, and meet with doctors who are comfortable with using platelet-rich plasma as well as use of lasers. A lot of times doctors get one laser, then another laser, and another laser, and will use, let's say, one laser to do one treatment, and then if the patient is dissatisfied, just move them over to another laser. Inevitably, the skin ends up getting thinner, and this is something that's not a very popular opinion, but it's something that I've observed over the 20 years of practice, beginning with the original CO2 lasers. So I hope that was helpful. I wish you the best of luck, and thank you for your question.